Students in abstinence-based sex education programs have been proven to be more likely to participate in alternative ways to engage in sexual behavior. 80% of students end up having sex before marriage despite the teaching of abstinence. This is a statement of Kathleen Parada's in her article, Anti-Sex Campaigns Abstain Only from Scientific Truths. There is an epidemic of teenagers 14 to 19 suffering from a lack of sex education. Most states require their schools to stress abstinence, even only provide that as an option against pregnancy and STDs. This means that teenagers in high school are not getting the proper education they need to understand relationships, contraceptives, and the importance of practicing safe sex at their age. But what exactly is abstinence-based sex education? Abstinence-based sex education means that schools stress waiting until you're married to have sex. Most people that are against other ways of sex education and for abstinence-based believe that teaching safe sex is the same as condoning sex. They believe that teenagers will use the information that comprehensive sex teaches and think it is acceptable for them to be sexually active and therefore raise the rates of teen pregnancy. Abstinence is the only 100% effective contraceptive against pregnancy and STDs, which is true. The government has even openly supported abstinence, going as far as to give $1.5 billion in funding to states to carry out abstinence-based sex education programs between 1996 and 2009. Also in 1996, the federal government started giving $50 million a year towards states to teach these programs in schools. This is according to Patrick Malone in his article, Comprehensive Sex Education versus Abstinence-Only Marriage Programs. Malone also goes on to show that criteria must be met to be considered an abstinence-based program. The requirements are as follows. Teaches abstinence from sexual activity outside marriage as expected standard for all school-age children. Teaches that abstinence from sexual activity is the only certain way to avoid out-of-wedlock pregnancy, sexually transmitted diseases, and other associated health problems. Teaches that a mutually faithful, monogamous relationship in the context of marriage is the expected standard of sexual activity. Teaches that sexual activity outside the context of marriage is likely to have harmful psychological and physical effects. Teaches that bearing children out of wedlock is likely to have harmful consequences for the child's parents, and society. Teaches young people how to reject sexual advances and how alcohol and drug use increase vulnerability to sexual advances, and teaches the importance of attaining self-sufficiency before engaging in sexual activity. But what is the other option? Comprehensive sex education is the alternative to abstinence-based sex education. Comprehensive education can be described as teaching sex education from a scientific, medically accurate, and age-appropriate way, meaning that you teach students about contraceptives, emergency contraceptives, reproduction choice, rights to your body as a minor, puberty, anatomy, how to build healthy relationships, and even education for those in the LGBTQ community. This is defined also by Patrick Malone in his article, Comprehensive Sex Education versus Abstinence-Only Until Marriage Programs. This type of education is not to be affected by religious or personal beliefs. It is purely scientific so as to give teenagers the most up-to-date and accurate information regarding their bodies, hormones, and how to practice safe sex in a non-judgmental and safe environment. Examples of comprehensive sex education in schools would be as follows. What are different STDs and how to prevent their spread? Self-respect and how to handle pressure to participate in sex. Consent, how to properly use a condom. Proper aftercare to prevent injury, where you can go to get contraceptives. What are emergency contraceptives and how to use them, the difference between male and female anatomy, and how pregnancy happens. And then also I have a chart if you want to look at that after to show how we plan to implement comprehensive sex education. But why should we include comprehensive sex education in schools? The problem with abstinence-based programs is they only work if teenagers actually practice abstinence until they are married. However, the truth of the matter is teenagers are not remaining abstinent and are instead finding alternative ways to practice sexual behavior with little knowledge on how to remain safe. Lauren Franklin, in her article, Abstaining from Abstinence, expressed that only around 20% of students in these programs stay abstinent, and the other 80% are more at risk of spreading STDs and teen pregnancy. Catherine Stranger Hall describes a study to show the effectiveness of abstinence versus comprehensive sex education in her article, Abstinence-Only Education and Teen Pregnancy Rates, Why We Need Comprehensive Sex Education in the U.S. So in this study, we take a few schools in their states and we level them on the type of sex education in their schools. 21 states stressed abstinence, level 3. 7 states emphasized abstinence, level 2. 11 states covered abstinence with comprehensive sex education, that will be our level 1. And 9 states didn't mention abstinence at all, that will be our level 0 schools. What they found was that level 3 states actually average a teen pregnancy rate of 73.24 per 1,000 girls aged 14 to 19. Level 2 states average 61 to 86, level 1 ranged 56 to 36, and level 0 averaged 58 to 78. So it's actually the schools that pushed abstinence that ended up having the higher teen pregnancy rates. This shows that there was actually a positive correlation between abstinence programs and teen pregnancy, and also indicating that abstinence education does not cause abstinent behavior in teens. Also, this study shows that we don't necessarily have to completely get rid of the idea of maintaining abstinence in sex education. Rather, a healthy combination seems to have the best results because we are giving our students options rather than demands, and we teach accurate ways to practice safe sex. And another reason why we need comprehensive sex education is because according to cdc.gov, there are few teens that actually are aware of how to practice safe sex. A few statistics on those are 40% have had sexual intercourse already, 10% have had 4 or more partners, 46% did not use a condom, and 14% did not use any method to prevent pregnancy, and 7% said that they felt pressured to have sex. Just depending on abstinence-based sex education programs has failed to decrease the teen pregnancy rate and makes our students ignorant of how to practice safe sex. From our recent studies that I have mentioned, comprehensive is a great option in teaching our students about contraceptives, their body, and how to maintain healthy relationships. Thank you.